So my name is Naa Ayele Amponsha. I'm an M1 first year medical student here at NeoMed, and I won the National Health Service Corps Scholarship. National Health Service Corps requires that for every year of scholarship support, you actually work in a community health center or one of their approved sites. So I plan on working in a community health center in Cleveland. Well, my goals as a physician are to take care of those individuals living in underserved communities, especially in urban areas. So this goal is really personal to me because I grew up in an underserved area. I grew up in Canton, Ohio, and I never had a physician as a young person, at least a regular primary care provider. So one of my goals is actually to give back and to sort of become the healthcare provider that I did not have growing up. And so this scholarship fits very well in my goals, and the fact that it allows me to financially be able to serve the communities that I'm most interested in serving. The scholarship is a full tuition, fees, and living expense are completely paid by the scholarship. It's an amazing scholarship, and so it impacts me in the way that I, as a medical student, will be able to leave medical school with very little to no debt. Which is a major, of course, financial incentive, but it also opens up the freedom of being able to pick and choose a primary care specialty that, otherwise with a large student loan burden, because I also went to grad school and undergrad, that would maybe circumvent me from actually realizing this strength in terms of providing care to the people that I really want to provide it to. So that's something that's really important to me. Definitely, before this opportunity, I was worried that I would have to choose a specialty that I wasn't really interested in, or that I was interested in but wasn't as passionate about as I am about primary care, especially in urban communities. So I feel like this is just a major blessing, kind of God's way of making sure that I'm able to serve the community that I feel most passionately about. And so, because the debt is a little bit worrisome, and the fact that it alters possibly your specialty or what you would go and specialize in. So this is definitely kind of relief that those fears and those worries, and I'm able to actually do primary care, which I'm really excited about. Necessarily, I was always interested in one of the primary care fields, including internal medicine, pediatrics, or OBGYN. I did a lot of work in grad school in terms of women's health, so obstetrics and gynecology was one of my interests, and it actually fits under the umbrella with this scholarship. And so it's actually kind of reinforced what I've wanted to do, because I knew that I've always wanted to have that kind of one-on-one relationship with a patient. That's really, really important to me. So being able to do that and being able to serve the community, it just feels awesome. And so to answer your question, my plans for my career in terms of the specialty I chose, I have not really changed after winning this scholarship. I would definitely say start working on your application very early, because there's a lot of steps to it and a lot of verifications and a lot of forms. The staff here at NeoMed were absolutely awesome in getting the enrollment forms and financial aid and all of those things, helping me through that process. And then I would also ask students to really dig down deep inside of your heart to ask yourself why specifically you're interested in this scholarship, because your authenticity of your true mission and your purpose really should shine through on your essay and in any of the letters of recommendation that are written about you on your behalf. And so it's really, really important for you to kind of understand your core value of really wanting to serve the underserved, wanting to serve individuals who don't have as much access to health care. And when you're able to articulate those values and articulate the way you feel, I really think it makes for a very strong personal statement and a strong application.